Assalamu alaikum. I believe we are live, just trying to go live on Instagram as well. My name, of course, is Shreen Mahmood. We are here on this, virtual conference organized by International Muslim History Month. It's 2024, hashtag Muslim History Month, hashtag Muslim Legacies. Now, of course, this is powered by World Hijab Day organization as well. You might recognize me from there. It's imperative to have platforms like this, celebrating and promoting Muslim achievement in our past and in recent times. Now, we are joined, of course, by special speakers every Friday. This week's topic is all about medical breakthroughs. So Muslim physicians and researchers leading healthcare from the past, from the current, and recent history as well. There's a lot going on in the world right now. It's the blessed day of Jummah. Let's also raise our hands in dua for our Palestinian brothers and sisters, our brothers and sisters who are struggling all around the world, places like Sudan, Congo. We are, of course, a platform that encourages and promotes justice and peace for all, from all faiths and all backgrounds and none. So may Allah subhanahu wa ta'ala make it easy for everyone. But let me introduce our special speaker, our special guest today. It is Dr. Uzma Syed. Now, she is an infectious disease expert, a TEDx speaker, an author, a leader within her own right. She's an executive member of Faiths4Vaccines. She's a mother. She's a recognized true trailblazer by a number of local, state, national organizations. She's even advised the government administrations. There's so much more I could say about Dr. Uzma, but I am going to invite her to stage. If she could tell us a little bit more. But firstly, a warm welcome to Dr. Uzma. Assalamu alaikum, and how are you?
Walaikum assalam. Thank you so much for that lovely and kind introduction. It's so lovely to be here this morning, evening for some of our global, committee members and audience that are maybe joining us all over the world. But this is, really a special time and a special place in my heart to really celebrate International Muslim History Month and talk about all the wonderful achievements of Muslims throughout history, throughout the world, and delighted to be here with you today.
Amazing. Thank you so much for joining us, because one of the biggest aspects of this negative narrative around Muslims, Muslim women specifically, is of course that we haven't actually contributed to civilization as we know it, and of course that's far from the truth. So we have a few questions to get through specific to the topic. And perhaps you can share your perspective and your journey as well, at various intervals. One of the first questions I wanted to ask is, what notable medical breakthroughs, are credited to Muslim physicians and researchers, of the past or in recent times?
Yeah, that's a great question. And I think it's really important. I love the way that you framed that question, because it's really important that we do recognize the significant advances in science because of Muslims throughout history. I mean, we're not just talking about recent advances, but this dates back centuries, and there's just so much literature and evidence to our forefathers and the history of the rich history of Islam and science, and how it goes hand in hand, and how there's been so many contributions in the field of science, things that we don't even think about on a daily basis. So it's really, we'd be doing a disservice if we don't go back in history and look at exactly how we got to where we are today. And just something simple, if you're looking at the field of medicine, people don't really know that there is Al-Zahrawi was credited as being the father of surgery. And if you're looking at the medical field and we look at the surgical practices that we have today and some of the tools even that we use, decades and centuries later were in fact created by him and are credited to him. So I think it's really important that we recognize the history of Islam and medicine and how it goes hand in hand. I mean, he was credited with creating things such as, the scalpel and the surgical hook and needle, and really in fine-tuning surgical methods so that we actually eliminate or minimize infections. So again, from an infectious disease standpoint, that's very important. From a medical perspective, obviously, this is, very, very important. He actually was the first one who had started marking the areas where he was going to perform surgery. And that's something that we're still doing today. We still use cautery, suturing. We still use all these surgical tools, something simple as forceps, and, scalpels. And again, all of these things that you don't even think about, especially in the medical field, this is so innate, so second nature. But if you go back and look in history, we can see that there have been so many prominent Muslims that have, in fact, laid the foundation for where we are today. And our history is just so rich. We can go back and look at the history from before of our forefathers that has brought us here. And then we can move along in time and look at the significant contributions of Muslims to science. I mean, there have been so many marvels and so many advances in research, in science, in medicine that, we can credit to Muslims. There was, just to name a few, we had a Nobel Prize winner who was Egyptian American who won the Nobel Prize in chemistry. He made significant advances in the field of chemistry, and we are so proud to have that. And if we just look recently, something that we cannot forget, just on the heels of the COVID-19 pandemic, we've seen so many Muslims that have been at the forefront in healthcare and in science and in research. And if we look at a company that we have all heard very frequently called BioNTech, we will look a little bit further to see that there were two Muslims, husband and wife, who actually founded that company in Germany. And they are actually the ones that actually are responsible for the COVID-19 vaccine. So BioNTech, along with Pfizer, was the one that released the COVID-19 vaccine, and that was in 2020. They had done clinical trials and research and just really breakthroughs in science, and really changed the scope of the pandemic so much. I mean, this was, a life-saving vaccine that was developed. And this is Dr. Uzma Syed and his wife, Dr. Uzma Syed, who were credited with really inventing, this messenger RNA vaccine. And so many advances. These are just like a snippet of the advances that were done in science because of Muslims, but we have been working for centuries to really advance the field of science.
Amazing to hear. I mean, COVID is, unfortunately, doesn't feel that long ago, the pandemic, and so much happened because of, COVID and the injections, vaccines, and, things like that. Lots more to discuss, I'm sure. And I think I'd probably want to mention at this point, going really far back into history, and mentioning Ibn Sina, and of course he's known as Avicenna in the West, but he's accredited to be almost the godfather of early modern medicine. Now, and his books that he wrote, I'm just reading actually, the famous works, of course, the Book of Healing, the Canon of Medicine, and that's like a medical encyclopedia, and it's still used, in universities to reference and things like that. And I know there's so much more we could discuss here, and I think it is very important to celebrate and learn about the Muslim contribution to important things like science and the medical field, because that, of course, not only does that encourage our youth, our next generations, to stand up tall with our heads high, but also empowers them that actually there's a lot more that we can be doing in this current climate, unfortunately, of increased Islamophobia, increased discrimination. We still have to highlight the good things as well that we can push through, and these breakthroughs are, subhanallah, so alhamdulillah for that.
No, I agree with that completely. I think there's so much focus on the negativity, as you said. We have to shift the focus, control the narrative, and really highlight the positive impact that we have made. And again, you can look back, there is so much history, and we are continuing to contribute to that rich Islamic history. And I think it's really important, as you mentioned, that the youth do see that the adults do see that we are, continuing to make impact, and we have the power to do so, and we have the knowledge and the intellect and the tools, and alhamdulillah, we are very fortunate, and we have to just keep working at it and keep highlighting and showcasing the contributions that we have made and that we continue to make.
For sure, and inshallah. So one of the things, unfortunately, within our communities, perhaps we've lost a little bit of the guidance, the healthy lifestyle guidance. And unfortunately, there's a lot of chronic conditions that have crept into our communities, such as diabetes. Now, I know in the South Asian culture, a lot of people have that, even in the Arab culture, where there's we were discussing this actually. A doctor was speaking to me about how if you're having dates, day, night, lunchtime, every time you have a cup of tea, now even that's a lot of sugar. Anything we have, of course, can negatively impact our health and cause things like diabetes. High sugar intake is related to cancer as well. Is there any advancements? Are we, as Muslims, have we been responsible within this field? Could you tell us a little bit more?
Yeah, I think the thing that is really important to recognize is how many Muslims are in the field of science, right? Alhamdulillah, we are so densely concentrated in healthcare, in research, in science, in medicine, and whether it be the field of endocrinology, which is very specific to metabolic conditions and diabetes, or hematology oncology, which is very specific to cancers and cancer research. There's so many advances that are being made on a daily basis, and there's so much emphasis. And obviously, when we are so connected to our communities, we can see, at firsthand the impact. What is happening in our communities. We have the pulse of the community. We have, we're sort of there, and we can see what's afflicting our communities, and that motivates us to, work even harder and be more invested in coming up with different solutions and different treatments and different, groundbreaking research and management of these kind of conditions. So unfortunately, there is so much that has changed over time with industry and with capitalism and with, if you just even look at the kinds of foods that are around us, we have moved so far away from natural foods and nutritious foods to processed foods and things that are really not good for us and not good for the health and well-being of children and adults, that, it's not surprising that we see rises in diabetes, that we have rising cancer cases because of the environment, the things that we're surrounded by, the things that we eat, and, all of these triggers. And so it is really, really alarming because there are constantly rising rates of diabetes and cancer happening in all populations, but especially, in the vast, diverse Muslim community that we have globally. And there are, like I said, so many Muslim physicians and scientists who are invested in finding solutions. If we go back a little bit and look at our prophetic teachings, I think it's really important that, we don't lose sight of that as well, that we have the balance, that we have modern medicine, and we have our prophetic teachings and the medicine of the prophet, which shows us, how to lead a healthy lifestyle. I think that's very, very important that we look at the types of things that we are doing to our bodies. Are we eating in moderation? Are we eating, natural foods? Are we balancing those things? And are we going back to our roots and looking at, keeping ourselves away from things that may harm us? So harm comes in many different shapes, forms, and ways. And some of this can be just from processed foods and things that we're exposed to. And so, there is a lot of work being done. There has been a lot of advancement in science, obviously, in treatments of diabetes, treatment of cancer, and there's constant work that's being done. And so many Muslims are actually contributing to these fields. But I think it's really important that we recognize, I usually participate in yearly webinars talking about how to have a healthy Ramadan, because I think it's really important that Muslims understand, how to really have the best results, during Ramadan, like as you mentioned with dates, and what kinds of foods, have high sugar content, what kinds of foods are high in carbohydrates and things like that, and are we balancing ourselves and balancing our meals? And it's during Ramadan that we develop these healthy habits, but we need to make sure that we're doing that throughout the rest of the year so that we are maintaining a healthy lifestyle. And once you control everything and you have things in moderation, you can really see that it's not all or none. It's not one extreme or the other. It's not Western medicine and, a balance of healthy lifestyle. It's a combination of both. And when you use these resources and you use these tools, you really want to make sure that you're focused on your health overall, and, eliminate all these things that are not good for you. And you will see actually in Ramadan, you can see a lot of benefits of fasting. We see that on the body. We see that there's been, teaching about this for, centuries, and we know this to be true. And now you can see recently there's been all this emphasis on intermittent fasting and the benefits on the body. And these are things that we already know hold true scientifically. So we've seen, prophetic teachings, the medicine of the prophet, Western medicine, and we've seen advancements from Muslims that have been contributing to this in every industry, most notably also in the field of medicine and surgery. And we can see that we're making a lot of progress. And they continue to work on this. And this is exactly what we are seeing globally, because as I mentioned, Muslims are so heavily invested in healthcare and research.
Absolutely. And I mean, it's actually, I think, I do believe in the UK, I don't know whether it's global, but it's Mental Health Awareness Week as well. And I do believe Dr. Rania Awad shared something about how, we were looking as Muslim philosophers, Muslim scientists and medical, physicians were looking at holistic treatments for things like depression, things like, having plants, having interactions with animals, the outdoors, as, this. And this still affects, modern medicine. I think, alhamdulillah, I'm a mother of 2 daughters. And, just even the tradition of tehneek, I believe it's called, and just putting something sweet on the top of the tongue of the newborn baby, and how that's linked to brain development, or it's amazing, subhanallah. So I think absolutely we've got a lot to shout about, from our history, in Muslim legacies, and of course International Muslim History Month. So alhamdulillah for everything that you've shared as well. We wanted to discuss a little bit about the role that you've mentioned already. There's a lot of representation within the medical field. A lot of, Muslims choose to go into the medical field now, whether that's cultural pressures that our daughters and sons must be doctors, but to our benefit, of course, as well. So, I mean, what innovative surgical techniques or medical devices are we pioneering currently? I know you've mentioned the COVID vaccine and, how pivotal it was about the Muslim couple from Germany. Is there anything else you can mention at this point? Or how can we encourage the next generation actually not to just be, and I don't want to say it that we're being basic, but actually just like these greats, so that there's Wikipedia pages about them, so that they're discussed for time, to come. How do we encourage the next generation to leave behind legacies as well?
Yeah, absolutely. And that word legacy is exactly how I wanted to lead this with. I think, so you mentioned it correctly that, and I had talked about this previously as well, how we do have a lot of Muslim representation in healthcare and in sciences and in research. And I think a lot of people are, drawn to the field because not only is it a noble profession, but you feel like you really can impact some change, especially in this day and age where things are so grim. And sometimes, there's so many things afflicting us, and, from climate change to wars to, there's so much negativity, depression, and, we want to think about something positive. We want to think, have a little bit of a positive outlook on how we can do something good and, impact people and impact communities, impact the world, and bring about positive change. And I think that's what the field of science and medicine really gives. It gives you that opportunity to really impact people, to make change, to heal people. I went into medicine for exactly that, and I went into specifically infectious diseases for exactly that, is because you can have interventions and see outcomes from that where you can heal people and nurse them back to good health, and it's really gratifying to be able to do something like that. And some of those examples I gave before, I think there's another really important thing that I wanted to highlight. We have an amazing trailblazer, a Pakistani American physician by the name of Uzma, who essentially created this amazing device that we still use today. I mean, he's created this Uzma device, which is groundbreaking for neurosurgery and for the way that we treat patients, that need chemotherapy. We're able to really aspirate. We're able to get samples of the spinal fluid. We're able to test for infections. We're able to treat with these devices. And it's a surgical procedure that he's credited with doing. And I mean, he was really a pioneer in this and did a lot of work on traumatic brain injuries and things like that. But this is his legacy. So when we talk about, advances in science, and we talk about, how can we motivate people, I think for young people, it's really important to keep their eye on the main point. So I always say it should always be centered around what's your why. Why do you want to go into medicine? Why do you want to go into research and science? And what is it that you hope to achieve? And then you build from that. And, and you always want to think about what is going to be your legacy? What is it that you're going to leave behind? What are you going to, and even if, every single person has some contribution that they make, no matter how big or how small, you want to just think about, are you part of that equation that leads to this, amazing breakthrough and amazing advancement in science? So whether it be something small or something big, like developing, our Turkish, German physicians that developed the COVID-19 vaccine. I mean, what a legacy, it's something groundbreaking that people will be talking about for centuries and centuries. So things like that, I think it's really important that you focus on that. Young people especially focus on the why. Why is it that you want to go into this field? And most of the time it's for the right reason. It's to impact change and to really have positive impact on communities, both locally, nationally, and globally. Because you want to, set an example and be part of something that leads to something greater, the greater good for all of humanity. And I think that's really something that we can focus on, the positive impact that people can have in healthcare and in science.
For sure, absolutely. And I think there must be so many examples that we lose along the way as well. Unfortunately, it's not always celebrated the way it is celebrated when non-Muslims achieve big in breakthroughs in whether it's science, whether it's in all these other fields as well. So I'm glad we're here talking and discussing this as well. And just before I go on, I have to say, we discussed technology and the advancements in that last week, and we have people tuned in from Malaysia, from Dubai, from Nigeria. So a big, massive Assalamu alaikum and peace be with you all from wherever you've tuned in. We are just ending, we're already coming towards the end. So there's still a few things that I want to get, mentioned on this, discussion. And we do, I know you're very, you're executive member of the Faiths4Vaccines, and I know we've mentioned the COVID vaccine and, the campaigns. It leads us almost onto the next question where, the disparities that we see. Yes, there's a lot of Muslim representation. A lot of doctors are actually from the Muslim faith. A lot of scientists are from the Muslim faith. Here, I can speak about the UK since I'm based in the UK. There's still a massive, disparity on how healthcare is accessed by Muslims, from people from different colors, different backgrounds, different faiths, by, different races, I mean. So, the disparity when we're talking about COVID vaccines, it's not easy to forget. People in Palestine, people in Gaza didn't have access to the vaccines like, the rest of, the population did. So can we discuss something about that? What do you think of that, and how can we improve things?
Yeah, so I mean, it's a really important topic, something that's very close to my heart, health inequities. We saw firsthand during the COVID-19 pandemic, nationally, globally, I mean, even locally, we would see the inequities. And unfortunately, the pandemic uncovered the stark health inequities that had been present for centuries, decades and decades and decades. It came to the forefront, and it really became so apparent that you couldn't turn a blind eye. You could just openly see how much inequity there was. And at every stage of the pandemic, it started with first just being able to get testing, just being able to get PPE, getting a mask. We saw that from a simple example, who were the people that were most affected by, COVID early on. It was the essential workers, and whether they were in the grocery stores, food handlers, food workers, whether they were people that didn't have the luxury of working from home, people that had to go into work to make sure that society kept going, even though the entire world came to a standstill and we had a lockdown. Food production was still happening. People still had to eat, and these are the people that were most impacted, because grocery store workers, people at shopping markets, they didn't have the luxury of being given a mask from their employer. They didn't have the luxury of social distancing. They didn't have the luxury of driving themselves to work. Oftentimes they had to take public transportation, and again, you're in that crowded environment with a lot of people, and people are sick, and you're not able to protect yourself. And that's how people started getting sick first, just from not having access to PPE. We saw the inequity there. Then we saw the inequities with the testing, people not being able to have access to testing. We saw the inequities with vaccinations, at every step of the way, vaccinations, treatments. Globally, we saw this very, very evident, where low and middle income countries just did not have access, had not even received one dose of the vaccine, while, the affluent nations were already onto their second and third doses and their boosters. So, this pandemic really unveiled, tremendous inequities that have been present. And we saw this throughout the world. We saw it in Palestine. We saw it everywhere, where people just did not have access to basic healthcare, and this continues to this day and age. There are people, that are displaced around the world, millions of people that are displaced, that don't have, even that are essentially not even given the basic tenets of healthcare, where they don't have access to immunizations, they don't have access to medications, they don't have access to things, medications and immunizations that can prevent and maintain their chronic conditions. And that makes them at risk again of developing worse infections, and antimicrobial resistance rises, right? Where they're developing more resistant infections, and then that leads to sepsis, and that leads to death. And so again, they're already starting off with a point where they're completely having so much inequity, and they're more vulnerable than the average population. And so, this is a stark reality of the world that we live in. And we hoped, since the global community came together for a singular purpose, for working on, treatments, testing, diagnosis, treatments, and vaccines for COVID, that things would get better, that we had learned, what a difficult state we were in. And unfortunately, even in the pandemic, in the midst of it, we saw how, the best in people came out, but we also saw the worst in people coming out, because again, it was all about, the most privileged, getting everything, and then those who are most marginalized kind of being forgotten, kind of being brushed off. And again, it's the difference between the haves and the have-nots. And, we have to really focus on how we can create a more equitable society and world for sustaining health and well-being for everyone. We have a One Health approach that we really focus on, and we have to be aware of everything that's happening around us to make sure that we understand that people's health is closely related to animal health, is closely related to our environment and climate. And, we can't forget all these things, and we have to keep equity at the forefront of that.
Absolutely, absolutely. And it's just I suppose, okay, so it's got to be a communal effort as well of speaking up. There's too many, cases closer to home actually where, accessing healthcare during the pandemic, there was a stark difference. And if you're not medically backgrounded yourself, or you don't know somebody in the medical field, not knowing how to navigate, certain conditions, or even in terminal cancer, for example, I've seen patients and patients' families just accept, decisions from doctors, perhaps, without any sort of research, because they're just not that way educated, right? Even from when my own nanny went into hospital and I had to put my foot down and say to the, that actually I want to see this X-ray, I want to see these results, and I want a second opinion. And so it's something that we, of course, ourselves have to, stand strong for, and then, inshallah, make impact within the medical, institutions, locally as well. So may Allah subhanahu wa ta'ala make it easy for everyone who has any sort of chronic conditions or ill health at the moment. May Allah subhanahu wa ta'ala give them shifa, and takes us on to shifa. When I say, when we say shifa now, I think it's impossible not to think of Al Shifa Hospital. There's been very specific, sort of targeted attacks on the healthcare system in Gaza as well. Of course, it's going through a conflict and a genocide, as described by the International Courts of Justice. And I think perhaps what we need to think about at this point is how important healthcare is and how lucky we are to have access to it. Just, it's about booking an appointment with the local GP, or it's going into hospital. We have A&E, and of course our brothers and sisters at the moment, they don't have that, on top of the targeting of medical health professionals, which again, against international human rights law. I suppose the question I'm sort of wanting to ask, since we have, a doctor like yourself online, is the people that are suffering right now, also with lack of food, lack of healthcare, lack of medications. Is there anything you can tell us a little bit more about that? I'm sure you've been gripped by what's being shown on social media, perhaps not mainstream media, but what is being shared on social media platforms and by the Palestinians themselves.
Yeah, I think it's a terrible tragedy that we're in globally, and this is something, again, not something new. We have been seeing, with history, there are wars happening throughout the world. There are people that are most marginalized, most vulnerable, that are always impacted. And, I mentioned before that we went into healthcare for the nobility of it and to be able to help people. And it's really devastating, when you feel like you can't help people or provide, the basic necessities. And I talk about health inequities and global health in this scheme very frequently, because we have seen characteristically and traditionally over time how, everyone wants to do something that's right to make sure that everybody has access to health, the basic human rights. And unfortunately, the global community, it just needs to do more to make sure that there is access to basic health, basic necessities of sustaining human life, right? Water, access to clean water. There's really lack of clean water in many places in the world. And this is astonishing, because when you talk about specifically infectious diseases, these are the things that promote onset of infectious diseases and poor health outcomes and outbreaks of cholera and outbreaks of, hepatitis and all these things that then lead to poor outcomes in children and in adults, not having access, I talked about, to immunizations, to medications, to all these things. So, again, it goes back to our human nature, our innate nature of wanting to preserve life. And our Islamic history and our core faith tenets of, having that, regard for life and preserving that life. We know that hadith, and we know that Quranic recitation where we talk about that saving one life is equivalent of saving all of humanity. So, we're hardwired to think that way. And that's the principle that we carry with us in everything that we do. And especially for healthcare workers, our emphasis is always about preserving life and promoting health and doing whatever we can to heal people, to nurse them back to good health. And some of these things are just basic requirements of sustaining life, of having, food and water and access to healthcare. I mean, having basic access to healthcare is so important to sustain life, for people and of all ages, children and adults. And I think, that's the focus, and that's, what we have to come back to as a global community always.
Mm-hmm. I mean, some of the most shocking, things to actually imagine or think, reality on the ground is, C-sections without any sort of medical anesthesia or, hygiene or pain relief. The fact that children are having, shrapnel removed from them, again, without any pain relief, the lack of beds, the lack of facilities. SubhanAllah, it's almost unbearable to witness. And I know there's a global trauma almost for us who are witnessing it, who aren't used to being in this situation. Would you have any advice, again, mentioning that it is a mental health awareness week? And again, I do realize how it sounds that, of course, we're not even suffering, like the people in Gaza are. Would you have any advice for people who are tuned in right now of what we can do to take care of mental health right now?
Yeah, I think it's really important. There is so much suffering happening all over the world. And I think, as you mentioned, there is so much that's inflicting, Muslims throughout the world. And because it is, Mental Health Awareness Week, I think it's something that stays with us all the time, whether it's this week or not. I think we have to find ways to balance, to sustain ourselves as well. And I think the most important thing that our faith teaches us is, you can feel helpless. And that's how majority of people feel right now, is this helplessness, but we shouldn't feel hopeless, right? I think if we always go back to our faith and our iman, and we know that, the power of prayer, the power of dua, the power of recitation of the Quran, those are the things that ground us, that help us keep our mental well-being, our physical and emotional well-being. We have to ground ourselves in that and know that, that there is, Allah subhanahu wa ta'ala is the knower of all. And, and this is our faith, this is our tenet. And we know that, we can feel helpless, but we should not feel hopeless, because we know that, there have been trials and tribulations for Muslims throughout history. If we go back to Rasulullah's time, there was so much that, he was inflicted with. So we can't lose sight of that. And I think if we always just get back to our basic core Islamic teachings and values, and we use that to ground ourselves, to make sure that we can go on from day to day, that we do promote good mental health for ourselves, for our children, for our communities, and so that we are in the best shape to continue to pray for those who are most affected, because there is so much power in prayer.
Absolutely, absolutely. Dua is the weapon of the believer, almost. We raise our hands in dua, of course, and like I mentioned early on, it is Jummah. I want to say a massive thank you. Thank you so much, Dr. Uzma, for joining us. And, a lot of things have been discussed, a lot of powerful messages out there. And I know, as a doctor, perhaps the faith perspective, isn't something you're usually questioned on, but it's been lovely having you here discussing this, so thank you so much for joining us. And what do we even say? Yes, there's a collective trauma that the Muslim community are going through right now, but you've mentioned it hitting the nail on the head that Allah subhanahu wa ta'ala is the all-knowing and, the best of planners. Maryam Amir actually shared something about this and mentioned Salahuddin, the Crusaders, and when Palestine was going through that, when Masjid al-Aqsa was, taken over and things like that. There's a lot perhaps the Muslim community are still to witness in terms of persecution and, these type of things. But all in all, we also understand that through adversity, we always come out in some sort of unity. And I think the most positive thing to finish on a positive is the fact that so many people from so many different faiths are standing up for justice right now, are using their voices, attending peaceful protests and doing as much as they can to see medical professionals come from all over the world and go to Gaza, not even Palestinian, not even Muslims, but that seeing that unity, seeing the students come out in universities and use their their democratic rights to protest peacefully against this injustice. I think that's powerful. So may Allah subhanahu wa ta'ala protect all our brothers and sisters around the world and show us a united front. And we pray for peace. We pray for peace and justice for all human life. Once again, thank you so much, Dr. Uzma, for joining us. We will be back next week. To all our brothers and sisters from wherever you've joined us and tuned in from around the world, please do connect with Dr. Uzma on LinkedIn, on social media platforms. Do follow her journey and, do connect with International Muslim History Month as well. We are again on X, on Instagram, on Facebook. Please share this important information that we've discussed today, that actually Muslim legacy is huge within the medical advancements and technological, fields and all sorts. So please do share. I did want to show you the other way you can engage with us is just making a sign. And this sign actually says May is International Muslim History Month. And I've just put there at just Shreen. And I'm from the UK, of course. Can't forget the Palestinian flag. So it's important that we share and support each other. It does become a bit of a sisterhood here. Of course, we're powered by World Hijab Day organization, our founder, Nazma Khan. But alhamdulillah, we have seen so much support from the brothers, from people of all faiths. And we hope that continues. In this mission of ours, that is, of course, to celebrate Muslim contribution and legacies, and also encourage and empower the next generations into some community cohesion and strength in unity, of course. So, without further ado, we will be back next week. Please do tune in and make sure you follow for any updates. Take care. God bless, and assalamu alaikum.